Good morning, everyone. Welcome. I am David Roth of DuPage Federation on Human Services Reform. This forum is accessible to Spanish speakers. I invite Eva Rafash to describe how.
Good morning, everyone. My name is Eva Rafash. Danica, would you be that kind to display the second slide? Thank you. The event will be conducted in English, and simultaneous English-Spanish interpretation is available for the presentations. Let me introduce our Hello, Topacio.
Hello everyone, hola a todos. Disponemos de interpretación simultánea, así que los participantes que hablan español podrán recibir esta interpretación si marcan el número 267-807-9611 y marcan el código 794-492 #.
I am also dropping this information in the chat box, just in case if somebody needs that, it is available there as well.
To our English language listeners, I want you to be aware that Spanish listeners are dialing a separate dedicated line for simultaneous interpretation. We're going to give them a couple of minutes to get caught up to us. And all of us throughout the presentation, I want to encourage us to speak in a deliberate tone and be aware that interpretation is happening as we are speaking our English. As we prepare to move forward, I want to encourage all of you to place your name and your affiliation in the chat. We'll keep a record of the chat. We'll keep a record of who is here and share that with participants so that you can continue to build relationships and make connections. I thank you all who've come on to the call, who've come into the forum for your incredible action to be welcoming. And I thank you for engaging with us this morning. Our goals are, number one, share best practices to equip you as you welcome and serve immigrants. Number two, we want to inspire collaboration and action among all of us who are here this morning. To accomplish this, we will present timely legislative and advocacy information. We will present research about the aging undocumented population, and we will break into small group exchanges. I want to give a really big special thank you to the work group that planned this event. I want to call out for thanks Claudia Valenzuela of Pillars Community Health, Dulce Ortiz of Mano a Mano, Karen Doyle of DuPage Health Coalition, Lisa Khalil of World Relief, Nancy Garcia Guillen of Southwest Suburban Immigrant Project, and to my DuPage Federation colleagues, Kristen, Danica, Lauren, and Julia. Today, as we listen to our presenters, we're going to use the chat function today for question and answer. That's the place for you to send up questions to the hosts or presenters. As we see presentations and hear presentations from the governor and from Fred and from Rob, we encourage you to set your screen to a speaker view. You can accomplish that in the upper right-hand corner of your screen. It will make it easier for you to follow their presentations. Now, to get us started, I'm very, very pleased to introduce the Honorable J.B. Pritzker, Governor of the state of Illinois, who will provide us a welcome message that he pre-recorded. Governor Pritzker is our perfect speaker because of his actions to make Illinois a welcoming state and to support our deepest value, which is that every family, every child, every human being deserves to feel safe and secure in the place that is their home. Thanks to Governor Pritzker's executive actions, bill signings, and clear public statements, the human dignity of immigrants has been strengthened to be free of harassment and discrimination, and our families have more confidence to take their children to school, seek medical attention, attend court hearings, utilize public services, and seek police protection. Here is the Honorable J.B. Pritzker.
Hello, this is Governor J.B. Pritzker. Thank you for attending the DuPage Federation's annual forum and for welcoming our new immigrant neighbors to our communities, municipalities, counties, regions, and all of Illinois. My own family were refugees who arrived in Chicago 140 years ago to make a new home. And even so long ago, they felt welcomed. It's a point of pride for me as governor to ensure state government does all it can to make Illinois attractive for new immigrants and to treat them with dignity. From expanding access to Illinois' welcoming centers to establishing the Welcoming Illinois office, from shielding tenants from having their immigration status used against them, to expanding employment protections for DACA recipients, to strengthening the Trust Act and the Voices Act. We have made great progress together. I'm particularly proud that Illinois is the first state in the nation to extend health coverage to all low-income non-citizen seniors and will soon be including people as young as 42 in this critical program. Our executive orders and policy changes are crucial, but wouldn't be complete without your leaders and staff stepping forward to implement them. In our schools, courtrooms, homeless services, park districts, doctors' offices, and all the places that shape Illinoisans' lives. So once again, thank you. I'm so grateful for all that you do.
And now I want to welcome Dulce Ortiz to the microphone to introduce our legislative and policy updates. Dulce is Executive Director, Mano a Mano.
Hi, thank you, David. Buenos días a todos. Good morning, everybody. As David mentioned, my name is Dulce Ortiz. I'm the Executive Director of Mano a Mano Family Resource Center, but I also have the pleasure to serve as the board chair of the Illinois Coalition for Immigrant and Refugee Rights, also known as ICER. And it's really an absolute honor to introduce the following speaker. Fred Tsao is a Chicago native born of immigrant parents from China. He's a self-described recovering attorney. Before gaining his current role as a senior policy counsel at the Illinois Coalition for Immigrant and Refugee Rights, Fred practiced law in Rockford and worked for the Illinois chapter of the American Civil Liberties Union. At ICER, he provides significant information on topics of immigration to internal and external partners, individuals, and community agencies like Mano a Mano that service immigrants. I really feel grateful to work alongside Fred because he pours his heart and soul into his work. And because of his commitment, our state is a more welcoming state to our immigrant sisters and brothers. So Fred, thank you for being with us today, and we welcome you.
Okay, thank you, Dulce. That was a great introduction. Your check's in the mail. Yeah, I have a slide deck which will spare you you're having to look at me. So let me make sure that this actually works. It does. So yeah, I want to take the next 15 minutes or so to go over some recent developments, one of which Governor Pritzker already mentioned in his introductory comments, but I think with any good news, repetition is your friend. So, yeah, let's move ahead. So there are a couple of significant developments in the way of one having to do with economic justice and another having to do with healthcare access that I want to make sure I cover in some detail. So first off, ICRR and quite a number of other allies have been working over the last few years to broaden out eligibility for the state earned income credit. Now, I'm sure most if not all of us are already familiar with the federal earned income tax credit, which is available to low and middle income families with children, and that can be claimed, basically when someone files their tax returns. So the state offers a similar credit, which is actually attached to the amount of the federal credit, and at least until a few weeks ago, eligibility for the state credit was aligned with eligibility for the federal credit. So unfortunately, that left out quite a number of populations. And, not the least of whom are taxpayers who file their returns using an individual taxpayer identification number, or ITIN, that's issued by the Treasury Department instead of a Social Security number. Now, I think all of us realize that a lot of immigrant families, a lot of immigrants, heads of households do not have Social Security numbers. They are still able to file their tax returns using an ITIN, but if they do so, their households are not going to be eligible for the EITC, or for that matter, at least until a few weeks ago, the EIC, the state EIC. So the campaign that we joined in with Economic Security Illinois, Heartland Alliance, the Shriver Center, Kofi, any number of other allied organizations, sought to change state law to enable certain other groups to be able to claim the EIC, including taxpayers who file with an ITIN, as well as certain households that are led by heads who that do not have children, but who may still have economic need. Specifically, taxpayers who are 18 to 24 years old, who are just basically starting out their careers, as well as seniors, taxpayers who are 65 years or older. So we also wanted to increase the amount of the state credit. It's currently 18% of the federal tax credit. We wanted to bump that up gradually, ultimately to 25%, but at least for this phase to 20%. So, we worked very hard last year. We couldn't get that over the finish line. This year we came back, kind of renewed our efforts, made this a much more prominent issue. We worked very hard with our allies in the General Assembly. We filed bills in each chamber. In the House, our sponsor, Carol Amons, got more than half of the chamber to sign on, members of both parties. And understanding that all of this would need to be worked out in the budget legislation that the General Assembly passed passed at the end of session, which this year was earlier than usual. It ended in April, and when it came time to enact a tax omnibus legislation, our EIC changes were included. So this means that starting with the 2023 tax year, which taxpayers will be filing for in 2024, ITIN filers and taxpayers who are 18 to 24 or 65 years or older will be able to claim the state earned income credit, and that earned income credit will be 20% as opposed to 18% of the state credit. Now, I should note here a couple of things. First off, our proposal for this year was actually a 3-year proposal. So we first off wanted to expand eligibility for the EIC, but in the second and third years, we also wanted to implement a child tax credit. And I think many, if not all of us, are going to be familiar with the federal child tax credit. under COVID relief legislation passed last year, this child tax credit was increased and made refundable. So many of our families were seeing monthly checks from the federal government to help support our children. Those provisions unfortunately sunset at the end of December, so that's no longer in place. And so, we were trying to enact similar legislation on the state level. We were not able to get that across, but the next phase of our campaign with Economic Security Illinois and all of our other partners will be to enact that child tax credit. Okay. The other thing I should point out is that so these EIC changes take effect essentially in 2 years. So what's going to happen in the meantime? Well, this state tax omnibus legislation also includes a rebate for many low and middle income households. Basically, it's any household whose income, whose reported income is $200,000, or if they're joint filers, $400,000, will sometime later this year get a rebate of $50 per tax filer, $100 if it's joint filers, plus $100 per child up to 3 children. So the rebate will be up to $400 maximum for a household. The really nice thing about this rebate is that those households that will be eligible for the expanded EIC will also get the rebate. So that means that taxpayers who filed using an ITIN during this tax season for last year should also get the rebate later this year, as well as taxpayers 18 to 24 and 65 and older. So hopefully that's good news all around for many of us and many of our families. Okay. The second thing I want to touch on, and again, Governor Pritzker stole my thunder on this, but I'll say it anyway, is that we at ICRR have been working with allies within the Healthy Illinois Coalition on expanding eligibility for healthcare coverage on the state level for immigrants regardless of status. So this actually we actually had an initial victory back in 2020 when the state created a program for immigrant seniors, that is immigrants who are 65 years or older. Last year, the state saw fit to expand that coverage to immigrants who are 55 to 64. And then this year, we've expanded that further to cover immigrants who are 42 years old to 54 years old. So as of July 1st, immigrants will, regardless of immigrants who are income eligible, will be able to apply for a Medicaid-like program funded by the state, regardless of their immigration status. And I should also note here that I think, as all of us realize, immigrant children under the age of 18 are already covered by the state under the All Kids program. So this obviously leads to a next step for future advocacy, which is covering anybody who's between the All Kids program and the program that covers 42 years and older. So, in subsequent years, we'll be working on 18 to 41. Okay. I should also touch on immigrant services funding. I see, folks from some of our program partners, so you're already somewhat familiar with this, but I'll, for those of you who aren't, I'll repeat this or state this. So the state funds the immigrant services line, which provides funding for 3 programs. The New Americans Initiative, which provides assistance for citizenship and DACA applicants. There's the Immigrant Family Resource Program, which provides community education, outreach, and navigation assistance for people who need to apply for safety net public benefits. And then more recently, the Immigrant Family Support Program, which provides direct cash assistance for immigrants, primarily focused on those immigrants who've been left out of federal COVID-related relief. So they were not eligible for the stimulus payments. They weren't eligible for expanded unemployment benefits, and yet, they need the assistance due to job loss or income loss. So that's what IFSP has been doing. So, there's my cursor. Okay, so last year, 2021, the General Assembly funded immigrant services at $44 million. This was an increase from $30 million from the previous year. It included $14 million in pandemic relief funding, as well as $30 million in general revenue. And we were able to devote 30 million of this to the direct cash assistance program. Since the General Assembly session last year, unfortunately, we've had a number of crises, including the Afghan refugee crisis. And so the Department of Human Services saw fit to provide additional assistance for the Immigrant Services Line to fund assistance for Afghans and also Haitians who were arriving at the southern border. So that brought us to 50 million. So we asked for 53 million, which was a slight bump. This was to, first off, help defray the costs of citizenship applications for many families who who earn too much to qualify for fee waivers, but are still needing assistance in paying for a citizenship application. And then the other major factor in this proposed bump was, of course, the very tight job market and people leaving our agencies to try to seek out work that's better paying and that's that they feel might provide other opportunities for them. So unfortunately, the General Assembly did not fully fund us. They provided $38 million in general revenue. That said, though, I know many of our organizations receive funding through refugee resettlements. Some of our organizations are welcoming centers, and those lines did receive really substantial increases for this coming year. The welcoming centers are getting $25 million. Refugee resettlement will get $50 million. Both of those, again, are significant increases. So the General Assembly is, in fact, making substantial investments in immigrant services, even if they're not providing as much funding for the immigrant services line as we would hope. Okay, let me touch on one other new state law. This is actually not new anymore because it passed last year, but I did want to make sure that people were aware of the Illinois Forward Act. This is Governor Pritzker in his remarks also mentioned this because this is the bill that, as he said, strengthens the Trust Act and the Voices Act. So this sets even further and stricter limits on police coordination and cooperation and communication with federal immigration authorities. And as you can see here the various ways in which this is happening. It also bars local and state police from inquiring about immigration status, because what they do not know, they cannot share. And then finally, and probably most famously, this law also ended the jail contracts that 3 county jails here in Illinois had with ICE to hold people for immigration detention. Now, we want to make sure that we are keeping track of various developments in local communities. This is legislation that does have to be implemented, at the local police department or sheriff's department level. So we want to find out whether local police departments are actually complying, or whether in fact there have been violations of this act. So I think many of us are already familiar with the family support hotline that ICRR runs. So if you are become aware of some instance where the local police are maybe cooperating with or turning someone there in their custody over to ICE, we want to know about this. So please share this phone number, 855-HELP-MY-FAMILY, or 855-435-7693. Okay. Okay, I also want to touch really quickly on a couple of things happening on the federal level. There's actually been a lot happening on the federal level, but I want to touch on two areas in particular. One is probably the bane of my existence over the last 3 years, public charge. So I know DuPage Fed and quite a number of other organizations, including organizations on this call, have been working in alliance on public charge on the state and local level to make sure that our communities are fully aware of what this is and what new developments have been happening. Just to make sure we're all on the same page, public charge is the part of immigration law that says that the federal government can deny someone entry or admission to the United States, or deny someone a visa or green card if they believe that that person is going to be relying on public support for their basic livelihood. So this became a big issue under the previous administration, which decided to put public charge on steroids and make many more public benefits count, including Medicaid, other medical assistance, SNAP benefits, housing assistance. All of those would count. They also wanted to impose fairly rigid quantitative standards as to who or what would count toward public charge. So for instance, if you're too old or too young, or don't have enough income, or don't have enough education or job experience, you could be counted as a public charge pretty much from the get-go. So what ended up happening was a major chilling effect. So there was so much confusion and fear that was created by this rule under the previous administration, that many people, including many people who were themselves eligible for public benefits, or their family members were eligible for public benefits, decided not to pursue those benefits or to withdraw from those benefit programs altogether. And the federal government, or the previous administration, was fully aware of this effect. They didn't care. They wanted to do this anyway. So, and if you don't believe me on that point, you can go back and read the document in which they published this federal regulation. So the new administration, the Biden administration, came into office last year, and did a couple of things. First off, they undid the previous administration's rule. They were enabled to do this by a number of court rulings challenging the previous administration's rule, one of which was in a lawsuit that ICRR and Cook County filed here in Chicago that led to a final judgment a final judgment that the previous administration did not act properly in issuing the public charge rule. So the Biden administration used that to leverage a rescission of the previous administration's rule, leaving in place a 1999 guidance that interpreted public charge much more narrowly. And I'll get to what that's, what that guidance says in a minute. And then the Biden administration followed through on this late last year by issuing what they called an advance notice of proposed rulemaking to basically get input on what a new public charge rule should look like. And then their next step was proposing an actual regulation that they planned to put into effect. So this regulation pretty much tracks the 1999 guidance. So medical, nutritional housing benefits do not count. The only benefits that would count under this proposal would be cash assistance like TANF or SSI or general assistance, or publicly funded long-term institutional care. So if someone is, say, in a nursing home and that nursing home care is paid for by Medicaid, that would count, but no other forms of Medicaid would count. Also, the only benefits that would count would be those used by the immigrant him or herself. So if there's a household member or, for instance, a child who is receiving those benefits would not count against the immigrant him or herself. And then, unlike the previous administration's rule, there would be no hard and fast standards regarding age or income or education or work experience or any of those other factors. So public comments were accepted through April 25th. We at ICR submitted comments, as did the Protecting Immigrant Families Illinois table, which DuPage Fed and ICRR and several other organizations sit on. I think many of your organizations also signed on to the PIF Illinois comments. We are waiting for the Department of Homeland Security to issue the final rule, which we hope will be in the next few months or so. Okay, and then the last topic I'm going to touch on is DACA. There have been lots of ups and downs and ins and outs regarding DACA ever since it was created back in 2012. When Biden came into office, the very first day he issued a statement saying that he intended to preserve and fortify DACA. Unfortunately, the state of Texas and of several other states had a different idea. They had filed a lawsuit 4 years ago challenging the Obama administration's actions in creating DACA. And those states were able to get the federal judge hearing the case early, to issue a ruling last year that said, states, you're right, the Obama administration did not act properly. So the judge fortunately left in place DACA for those who already have it or had it at that point. And those folks are able to continue to work. They can maintain their work permits, they can renew their DACA. Unfortunately, people who never had DACA or are newly qualifying are out of luck. They cannot, they can submit applications, but Homeland Security cannot do anything with them. So Homeland Security has issued a proposed regulation to essentially write the DACA program into place. There were public comments. There was a public comment period that was open late last year. Homeland Security still has not issued the final rule on DACA, but again, we're hoping to have a more final word on DACA in the next few months or so. So that's all I'm going to cover for today. I know there are lots and lots of other things that are happening, but I will pause there. Dave, do we have time for questions or?
Let's get a couple in. We've gotten a couple, Fred, that have come in through the chat. Julieta Alcantar Garcia asks about web resources for the presentation that you've made, things that she would have to refer to.
Okay, so first off, I'm happy to share the slides. I think I did share them with you, David, and with Danica. So I'm happy to have you share the slides with folks who are online right now. So far as keeping track of developments and updates, I've subscribed to various listservs with Department of Homeland Security and U.S. Citizenship and Immigration Services, for one thing. There are a number of other listservs. Catholic Legal Immigration Network, or Clinic, has really nice news feeds. The American Immigration Council, the National Immigration Forum, Immigrant Legal Resource Center. I could go on and on with these, but there are quite a number of other resources, and of course our own website, icrr.org. We try to keep things pretty up to date. I can't say that we're perfect in that regard, but you can usually find some really good information. And if you can't, you can also always feel free to contact me as well.
Very good. And one other question from Julieta regarding Illinois Way Forward. What if there is non-compliance? What's the remedy?
Okay, so right now, the remedy is to report this to the state attorney general, which this law does give the attorney general the authority to investigate and to essentially bring a lawsuit to force the violating agency to take corrective action. So unfortunately, we were not able to get in any provision that would enable people who are directly affected by this by such a violation to bring their own litigation. They can do that already under some existing law, but it's a little tricky. But that's part of the reason why we want to make sure that we're tracking violations, so that if we see lots of violations and we see that the attorney general is not quite doing the job, we want to be able to go back and say, look, we really need this authority to bring our own lawsuits.
Thanks, Fred. Now, we have some more questions appearing in the chat, and I want to say to those who are putting them in, we're going to get an answer for you, but it is important that we move forward at this point. I want to thank Fred so much for this presentation. You've given us concrete resources for benefits to our constituents. We now have information to share to encourage them to get benefits that are coming to them. And you've given us advocacy hope for the future. Thanks so much. And now I want to bring to the microphone Karen Doyle. Karen is Director of Development and Communications at the DuPage Health Coalition. And Karen, I would ask you to introduce our research presenter.
Good morning, everyone. Thank you, Dave. It is my pleasure to welcome Rob Perel. Rob is a demographic and public policy consultant with specialties in immigrant, Latino, and Asian populations, community needs for health and human service programs, and Midwestern demographic change. As principal of Rob Perel and Associates, Rob has assisted more than 100 different human service advocacy and philanthropic organizations in understanding the communities they are trying to serve. He works with large-scale data and geographic information systems to develop insight into community assets and needs. Rob is a research specialist with the Great City Institutes of the University of Illinois at Chicago and a non-resident fellow in the Global Cities program of the Chicago Council on Global Affairs. He was the Senior Research Associate of the Washington, D.C. office of the National Association of Latino Elected and Appointed Officials and was Research Director of the Latino Institute of Chicago. He has been I lost my place here. He has been a fellow or adjunct of the Institute for Latino Studies at Notre Dame University, DePaul University Sociology Department, and the American Immigration Council in Washington, D.C. But wait, there's more. You can find further information at robperel.com. I do not have the privilege of knowing Rob, but those who do have described him as an accomplished good guy. So I'm excited to hear what he has to say, and please join me in welcoming Rob.
Thank you, Karen. Thank you very much. Can everyone hear me?
Yes.
Okay, thank you. I'll share my screen in a moment. And before I do, thank you, David, and Karen and Danica and everyone at the DuPage Federation for inviting me. I appreciate it very much. And Fred, it was great to hear your presentation, which was comprehensive and on target as always. So I'm definitely in very good company. I'm in good company with 100 people, in fact, I think today. So thank you very much. So I'm going to talk about a report that I worked on regarding the undocumented population in Illinois and what's going on with older persons who are undocumented. I'll begin to share my screen here, and bear with me a moment. Okay, David Roth, can you indicate to me, is everyone seeing my screen right now?
We're good.
Okay,
We're good.
good. Thanks a lot. Let me make a little adjustment here. Little adjustment. There we go. Okay. There. I wanted to start out by just talking about a fact of human services that's even bigger than immigrants. And it's going to affect us more and more every day and year as we go ahead, which is that we live in a society which has a dramatic aging process going on. More and more Americans of any immigration status or background are moving into their older years, in their 50s, 60s, 70s. The baby boomers moved into this phase, and it's going to go on for a long time still. And you see an image here that shows you how back in 1960, for example, there were really very few older Americans as a percentage of the population. But you look ahead to a few decades, what used to be what they call an age pyramid is becoming an age pillar. You know, people are getting older. It's a little hard to get across sometimes to people how important this is, because it's not something we see from one day to the next. It's like an incipient ongoing change in our society, but it'll have and already has a lot of effects on human services, who has need, what kind of services people have a need for, et cetera. So that's just a little bit of background to start out and get us thinking about what does it mean to have an aging society. But more specifically, then, I wanted to talk about immigrants and the undocumented. And there's a story that's kind of special going on with immigrants and undocumented immigrants in the United States and here in Illinois. You know, I also should make a note here. If anyone has any comments, I assume they'll come in by chat. If anything is something that we should take up while I'm in the middle of a slide, I'm good with that. Maybe someone can, David can chip in or something like that.
I'll do that, Rob. I'll keep an eye on it.
Yeah, thank you, everybody. Thank you, David. So what's going on with immigrants and the undocumented in terms of aging? Well, first of all, Illinois is lucky to be a state that has had immigration for a long time now, going back to, you know, most recently going back to the 1960s. So by that fact alone, we're a state with a lot of immigrants who have been here quite a while, and many of them, of course, are aging into becoming seniors. The other thing is that we're getting relatively less immigration today in Illinois. We get something like 30, 40,000 immigrants a year of all statuses. But, you know, we used to get immigrants at the level of like 60,000 a year. So we're getting somewhat fewer immigrants, and that alone means that the immigrants we have on average are older persons, okay? But then with the undocumented, there's still one more fact that's really critical, which is that, you know, prior to 1960, and many of the Mexican Americans on the call right now are going to know this, because you think back to your grandparents, you're often going to hear this story, or great grandparents, that prior to 1960, there were ways that people could come and work in the United States, especially from Mexico, and they could do it legally through something called the Bracero program. This might sound like ancient history, but up until the 1960s, the ability to come to the United States was not that hard to do the kind of work that our society and economy needs. Beginning around 1960, we start this crackdown on crossing of the border and staying here. We terminate that Bracero program. And what happens is we continue to need immigrant workers in our society and economy. We no longer provide that legal way of being an immigrant worker for many people. And so we begin to accrue this large population of undocumented immigrants. Now, in 1982 was the last time that there was a program where most undocumented immigrants could legalize their status. We're in 2022, that's 40 years ago. We have gone 40 years in the United States with no major ability, no major program for undocumented immigrants to get a legal status here. So when you go 40 years, you accrue both a large undocumented population, but think about this, and this is where we get to the question of seniors. If you came after 1982, as many people did, the 1980s and 90s were big years for immigration. If you came in the 1980s as a 25-year-old and you were undocumented, well, guess what? You're 65 years old now. Or if you came in the 1980s in your 30s as an undocumented immigrant, 40 years have gone by. There's never been a way to legalize your status, and you're in your 70s now. So what has happened is, in a state like Illinois, we've accrued this large population of undocumented immigrants that have been living here, working, paying taxes, et cetera, for getting towards half a century, you know, and now they're in their so-called retirement years. So that's the situation. And what we tried to do in this report that was supported by Rush University is to quantify, well, how many people are we talking about? And what does it mean? And I should give thanks to Padraic Stanley at Rush University, who, like so many leaders in the community, is an ICIRR alum. It was his idea to quantify the undocumented senior population and start to get institutions to talk about it and think about it. So, so how many people are we talking about as the undocumented move into their senior years or their older years? If you can see the cursor on my screen moving around here, at the moment, we just have several thousand undocumented immigrants who are over the age of 65. But you move ahead just about 8 years from now to 2030, we're going to have almost 50,000 people in that category. It's kind of like the baby boomers moving into their retirement years. Well, the undocumented are moving into those years too. So we're going from 0 to 100, so to speak. We're going from a few thousand to 50,000 people. Well, what does that mean? I mean, so what, right? Well, what happens as we age, right? When we age, we can't work. When we age, eventually, we shouldn't have to work. When we age, we have medical needs, don't we? That's why we have something called Medicare. That's why we have something called Medicaid for the rest of the population, right? When we age, we need some kind of income support sometimes to live in dignity if we don't have enough money otherwise. That's why we have Social Security for the rest of the population and why we have supplemental security income for some of the rest of the population. And all those things I just listed, those are denied to the undocumented, even though we're looking at so many people that are going to be in those categories. So that gives you a sense of the scale that we're talking about, 50,000 people. That's just one category. When you add in the people 75 and over, we're looking getting towards 60,000 in less than a decade. There's a couple more points I wanted to make about who we're talking about. And, you know, those of us here on this call, we know this, right? Immigrants in many ways are human beings like anyone else. And there's not that much difference in many ways between undocumented immigrants and the rest of us. And here's what I mean. The statistics on this screen show that undocumented immigrants who are 55 years and older, talking about older folks, you know, they're working at about the same rate as the native born. They have an employment rate that's about the same as the native born. They're more likely to be looking for a job than the native born, but, you know, very, very similar characteristics, slightly higher poverty rate. So in some ways, the undocumented look like the rest of us. But then I wanted to show you some ways in which the undocumented senior population, talking about people 55 and over, actually look very different than the rest of the population. And it does raise some questions for those of us in human services to think about in terms of how do we take advantage of these facts I'm about to show you. Well, many of the folks on the call are immigrants themselves or children of immigrants. And so what I'm saying won't surprise you, which is that guess what? Undocumented older immigrants, they live in families. Much more likely to live in families than the native born population in Illinois. So for example, very few undocumented seniors live alone, right? Immigrant seniors generally don't live alone, not at all like the native population, where a quarter to a third of all of our seniors live by themselves among the native population. And it's not like undocumented seniors only live with just their spouse, perhaps. They're very likely to live in 3-generation households, right? And I'm sure this makes sense to a lot of you listening to me right now. People live with their children and their grandchildren, far more likely than the native population. It's always funny, isn't it, how immigrants in so many ways look much more like the ideal of America than the Native Americans do, in the sense of being in families and being close to families and enjoying closeness. You will find that when you look at immigrants. So the undocumented seniors, they're living in households with 3 generations. They're living in households that has a child in it somewhere. Younger adults, they're much more likely to be in households where someone's working, of course, or where someone's in the labor force. So let's think about some of the pros and cons and issues that come from this. Well, the good news is that undocumented seniors are relatively less likely to be alone. They're relatively less likely to be without some kinds of support. And when I say support, I mean family support, right? I mean, that's good, right? And we should find ways to take advantage of that somehow, either in terms of how do we reach those seniors, how do we deliver services? But let's talk about the flip side of that for the rest of that family. It means that immigrant families are responsible for undocumented seniors who have no access to programs, right? So the burden of medical, social, other kinds of care of seniors, transportation, et cetera, falls on families when you look at immigrants and undocumented immigrants. So those are some of the major kind of characteristics and things to think about for all of us. I wanted to move on and wrap up here in just a minute and say, what are some of the things we need to recognize and start to think about? And I know you're going to have some conversations among yourselves today. What are some of the issues with the fact that we're facing this tsunami of aging undocumented immigrants? And on the screen, there's some thought bubbles here. What do we do about the cultural competency and the preparedness of our institutions to serve seniors, the language abilities of medical providers, the cultural competence to understand the needs? Think about mental health care. How do we bridge the gap between what organizations have traditionally provided in terms of who they serve and the fact that we now have persons who speak other languages, come from other cultures, may have very different attitudes and understandings of what mental health care is, different norms and perceptions. Couple of quick comments on geography. I didn't make any notes about who we're talking about here. I'll tell you where to find undocumented immigrants right now. I have a magic way for you to find where the undocumented seniors are, all right? And it's very easy. If you want to find undocumented seniors in Metro Chicago, find immigrants. So the undocumented seniors are in all of the major immigrant population areas of DuPage, the Western Cook suburbs, in Waukegan, in Western Lake County, in all of the ring cities like Aurora, et cetera, around Aurora, Elgin, Joliet. That is where you'll find the population. So it's everywhere, all right? And then, yeah, so what do we do to begin thinking about the institutions that do serve the undocumented? How do we, or should serve the undocumented? How do we improve their preparedness, their staffing? Boy, when I talked to folks and it came up today, the human service community has been hit so hard by the difficulty of staffing up and maintaining staff. What does that mean when we're in an era when we not only need to maintain staff, we actually need to change staff so that we have more culturally competent staff? So those, I think, are some major issues. There are many more I think you'll come up with. I'll wrap up here, and happy to take your questions. And again, just very proud to be here with the DuPage Human Services Federation today. And thank you very much. Yeah.
Rob, thanks so much. What we're getting in the chat are a lot of shout outs and affirmations and appreciation for the work that you're doing. What I want to do is encourage folks to take a look at those affirmations. And, you know, we don't have specific questions coming up in the chat, so I will invite folks to be thinking about that now and drop in the questions that you have. And in the meantime, Rob, if I could, I wonder if you might talk a little bit about how you're seeing reception of your report in the community. Where are you seeing energy and interest? Where are there partners and allies that we want to be thinking about building relationships with?
Yeah, perfect. I think, well, the reception of this report was very good. ProPublica covered it along with the Chicago Tribune and in a major 3 or 4 part series. And it got quite a bit of attention because everyone is seeing this coming now. So no one can deny this or argue against it happening in a big way. I think when we talk about partners, there are some opportunities here, which is that let's think about the organizations that serve older Americans. For example, we have the Older Americans Act, which provides funding to I'm forgetting the name of the organizations around the state of Illinois, the senior serving organizations that manage Older Americans Act funds. How do we help them reach out and understand the older population that is growing in their communities? How do we help them decide whether they're currently being equitable with their services? And they want to be equitable. It's not a question of wanting. How do we help them break down barriers of communication? How do we help them staff up, as I said? How do we help organizations just start to think about the fact that the older population, not only with undocumented, but the older population is just getting a lot more diverse. The older population, I can tell you, for example, in suburban Cook County, just to give you an example, the majority of seniors, older persons, are still white, but the share that is white every year is going down and down and down. So the diversity of seniors, older persons, is really growing. Both in terms of percentage Latino and Asian, but also African American. Our cultural competence concerns, it's not just about immigrants. It's how do we make sure we're reaching African Americans and equitably serving them? They often live in very isolated communities in their own way. And how do we break down those barriers? So in terms of partners, how do we partner more with the senior serving organizations? And then last thing I'll throw out is, now that we've made people eligible for healthcare, what do we do about all the medical institutions that need to be able to communicate with seniors?
Very good. So one of the things that I want to do is a lot of the shout outs that I'm hearing are coming from people who are affirming what it is that you've said. And I would invite those who have entered those stories into the chat. If anybody would like to unmute their mic and share one of those stories, that would be just fine. We also have with us today 2 of the area agencies on aging for Suburban Cook and for the Collar Counties. Age Options and Age Guide are with us. And I want to invite those representatives also to join into the conversation. Feel free to unmute your microphone and make a comment or offer a question if you have one for Rob.
Hi, everyone. I'm Peter Beyer from Age Options. I don't actually have a question. I just want to affirm Rob's work here. And we are working with Rob actually in some of these very same issues. And it's obviously critical to see what's coming. And this is the kind of data that is really valuable, and we appreciate it. And it's definitely a major part of what we see our work to be in the coming years. So thanks for this, Rob, and just for anyone who got this together, because this is a very critical thing.
Hey, I want to say welcome back to all of you. Thank you for your perseverance through our technical difficulties, and for your discussion, and for your note-taking. In just a minute, I'm going to invite Nancy Garcia Guillen to introduce our closing from the Youth of Southwest Suburban Immigrant Project. But first, a couple of things real briefly. Thanks so much to Rob Perrell, Fred Sau, Governor Pritzker, and the Youth of Southwest Suburban Immigrant Project, who you're going to see in just a minute. Thanks so much for your work to present to us. When the closing is complete, we're going to ask for your feedback to this event. We will drop a link into the chat and ask you to click on the link and take just 1 to 2 minutes to complete the survey. We'll keep the meeting open for a few minutes after the closing to make sure that everyone can access the link. And I want to remind you that we will share the PowerPoints of Fred and Rob. We will share a recording of this session. We will share the chat, and we'll share a link to the Jamboard that has been completed. So now I want to invite Nancy Garcia Guillen to unmute herself and to please introduce our closing.
Yes, thank you so much, David. Of course, good morning, everyone. My name is Nancy Garcia Guillen, and I am the Director of Civic Engagement with Southwest Suburban Immigrant Project, SSIP, in Bolingbrook. And I am pleased to invite some of my colleagues from SSIP, Alexia, Louis, and Jimena, to share the closing remarks. Let's give them a warm welcome.
Thank you, Nancy. Hey, everyone, how's it going? I'm Louis. Just wanted to see, how are we doing? I know we're about to close the event. If you guys could give me a thumbs up if you guys still feel good. Awesome. I feel a lot of thumbs up. Cool. Well, without further ado, my name is Louis, and I'm a community health worker here at SSIP, the Southwest Suburban Immigrant Project. For those of you who don't know, SSIP is a nonprofit, community-based organization here in Bolingbrook. And I've been working in this position for a full year now. Prior to this, I worked as a census organizer and a Democracy Project Fellow with ICER. And what brought interest to me about the work that I'm doing now is I recall growing up in the suburbs, going to health clinics with my parents. My parents didn't speak or know much English at the time. And oftentimes, here's a little me, 8-year-old, trying to translate letters that came in the mail regarding bills and, other important documents. So me personally, having grown out of the All Kids program, I didn't have a clue that once I turned 18, and health insurance was on me. I later realized I couldn't qualify for healthcare because of my immigration status. My parents weren't so fortunate either to have a program like All Kids. My mom is diabetic and was misdiagnosed in a clinic and received the wrong treatment for a long time. She had to go through a lot of doctors and navigate a lot of questions regarding financial assistance. But recently she had to go to the emergency room at a different hospital, and it felt very different because they did tell us about financial assistance right away. so that she could focus on recovery, which is good. We know that eligibility isn't the only thing that excludes folks from our community from applying for benefits of all different types. I saw this with the public charge chilling effect, and I've personally experienced this with DACA. I was eligible for the program when it was first instituted during the Obama administration, and the lack of information, money, and not knowing how my information would be used hindered my ability to apply. And my family and I weren't informed that applying for DACA and benefits was safe. All of this motivates the work that I'm doing now. At SSIP, we believe that empowering our community through education, civic engagement, and advocacy is what we strive for. In comparison to my younger self, I am now capable of guiding others through acquiring healthcare, making vaccine appointments, and applying for citizenship and renewing their DACA. These experiences I had as a kid motivate me to do the work that I am doing now. And I'm so fortunate to be surrounded by an awesome team. So with that, I'll introduce you to some of my other team members. Alexia will discuss more about the work that we do. And then following, Immigrant. Thank you.
Thank you, Louie. As he mentioned, my name is Alexia, and I'm also a community health worker with SSIP. I've been with SSIP since 2018. Prior to this work, I was a youth intern, and I've worked through various other programs in the organization since. As an organization, SSIP's mission is to organize for the rights of immigrants in Chicago's Southwest suburbs through education, civic engagement, and advocacy. People reach out to us with specific needs ranging from immigration assistance to healthcare because we're a trusted resource to the community. Some, however, have shared their stories of discrimination, issues in communication, or simply being denied care. Because of these stories and a general need, we decided to create and launch our health justice team just last year. The health justice team was specifically designed to assist and provide resources for our hard-to-reach communities, not only for all things health. As a team, we heard many different experiences shared by community members that had gone to the emergency room, whether for COVID-19 symptoms or other reasons. Often these folks were left with large outstanding bills due to no medical coverage. I don't know, have your agencies experienced similar calls to these? If so, you can let us know in the chat and I'll give you guys a second or two. It's okay if you don't want to share. So we have seen that this was true for a lot of us, and many families we spoke with were not told that the hospital has a financial assistance application that can help cover a portion or all of their debt from their stay. When they did hear about these programs, families were often afraid that they would have to disclose their immigration status in order to apply. Again, this happens more often than we would like to see. In the information gap, our organization committed to guiding these community members in filling out the application and sending it in. So far, we've helped 23 people with this hospital assistance application.
Hey, Alexia, we have a request in the chat that you repeat the question that you offered out. There are lots of folks in the meeting who probably have a response. Do you mind repeating that?
Yeah, so I was just mentioning how a lot of families are afraid to disclose their immigration status, so they won't ask about programs that hospitals may offer, and just wondering if any of your agencies have had a similar experience.
Yes. You see the heads nodding.
Yeah.
Yes. I've had quite a few here. It's incredible how we had and it was a priest telling a family they had to send their loved one to Mexico. Well, they were still on a ventilator due to COVID, and that hospital owed so much money. They already owed so much money to that hospital, and the best thing was that he could help them send their father to Mexico. And we're like, if he can't even go home, you only let him go home here, what makes you think he'll survive a trip to Mexico? you know, but it has been a struggle here for my colleagues and I. We've had to go to the hospitals and to advocate for the patients because unfortunately they're undocumented status, you know, and it is scary. It's scary to see that they want to move our people out when they need to care for them first. They need to make sure they're well. And fortunately, we were able to have this gentleman stay there until he was well. But they wanted him out. They wanted him out, and it was very sad. And there was only one, a young man, probably the same situation as Luis. He's the one that knew both languages, and the doctor's telling him, you know, the medical terms that the boy's like, I'm trying to tell my folks what's going on, but I don't even know what the doctor's telling me, you know, and that is difficult. Luis was saying he did this when he was 8 years old. This young man is 16, trying to tell his folks what's going on and why are they sending his father to Mexico. So it was all when they came to us and we were able, you know, Cristobal and I are bilingual, we were able to help. And he was so thankful to us because we were helping him translate. We were helping him and make what their folks were telling the doctor understood. He said that was a major help. That was a major help. I was having the worst anxiety over this. Because
thank you for sharing, Julieta. We've all experienced these similar things, right? We hear from our community members, so being able to advocate for them is really important for us. Like I mentioned, we've been able to help 23 people with the just filling out charity care applications. We just guide them, right? And then we help them advocate if anything goes wrong. But thank you for sharing. So at the peak of the pandemic, SSIP also had a financial assistance program. It was called the Solidarity Fund. This was fueled by community donations. Through this fund, we prioritized assistance for families affected by COVID-19 that did not receive a stimulus check and did not qualify for other government aid. Through all our financial assistance programs, we've been able to help over 980 families with rent, utilities, and hospital bills. In addition to application assistance and other direct services, SSIP focuses heavily on community education. Information on COVID-19 was spreading fast throughout social media, and with that came a lot of myths and misinformation. Sometimes we were able to correct the misinformation by talking to our family members and such, but we knew that addressing larger issues would require a more intentional and community-wide effort. So to reach more community members through one-on-one engagement, we established cohorts of health navigators. Our current health navigators are a group of 13 community leaders that receive online training and resources that they can share with the rest of the community. Through canvassing local grocery stores, schools, their neighborhoods, and even speaking to their own family and friends, they've reached over 6,000 people and counting with health resources. So when the COVID-19 vaccine became available, it was critical to our organization that communities of color and immigrant communities had access to appointments, especially because, as we know, they were impacted the hardest through the pandemic. Through our organizing and collaboration with other Will County-based organizations, we hosted over 10 community-based and led vaccine events in the Joliet and Bolingbrook, Romeoville area. To summarize what we have learned through the pandemic is that you have to be creative in meeting the community where they already are. So I will now hand it over to my colleague Jimena to share some of our more creative initiatives and encourage your creativity as well.
Thank you, Alexia. As Alexia mentioned, creativity has been where our team has shined. From joining our local libraries, bookmobiles, to hosting virtual game nights. We have invented and reinvented throughout the pandemic to be sure our community has access to health equity. This creativity is especially important in communication as we continue to see chilling effects from a public charge and other harmful federal policies. For us, these creative communications has looked like our health navigators that Alexia previously mentioned, but also has taken shape through adjustments we made through our regular office intake. I'm not sure about you all, but it can sometimes feel like we've received mountains of calls each and every day. While it can sometimes be intimidating, we realize that our intake calls were the perfect place to share information in creative and concise way. Folks are calling our offices because they trust us and they trust the resources we have. An incredible opportunity to disperse fear and provide resources in addition to the ones they are currently calling about. To close, I want to encourage everyone to activate your creativity as well as navigate whatever phase of the pandemic we're in. Don't be afraid to try new things. Sometimes they work, sometimes they don't, but folks always appreciate being intentionally engaged. Finally, at SSIP, we believe everyone deserves access to quality, affordable healthcare, regardless of barriers that have historically excluded folks. As we talk about creativity, I challenge us all to join in advocating for this type of healthcare. This legislative session, we won an expansion of the state's Medicaid-like program to cover everyone ages 42 and over, regardless of their status. As we dream of ways to expand this coverage to everyone, I invite you to join the fight, volunteer at application assistance events, call your legislators, and together we can win healthcare access for all. And I'm excited to continue the fight with you. Thank you.
Thank you. And Nancy, I just want to check in that the closing is complete. I don't want to stop it too soon.
Yes, thank you so much.
Well, I thank you very much. And thank you, Alexia. Thank you, Louis. And thank you, Zamina, for that sharing. And Jamina, that final bid to us to activate our creativity is the perfect thought to close out this forum with. And I thank you for that.